Good evening, and welcome to another broadcast here on blackdoctor.org. Thank you for joining us this evening. We are excited to have you here. I am Ellis Dean, your host from blackdoctor.org, and thank you for joining us for this community conversation designed to get you and your children ready for school. We've called tonight's event Checklist for a Healthy School Year, and I know parents and caregivers will appreciate the information our all-star panel of physician experts from Cedars-Sinai has to share. Today's discussion is also available via simultaneous interpretation in Spanish on our Daily Vitamina Facebook page. Tonight, our experts in child and adolescent medicine from Cedars-Sinai Guerin Children will be on hand to answer your questions about everything from school physicals to scoliosis screenings to vaccinations and teen mental health. Start back to school season off right and ask the experts about colds and flu, allergies and asthma, injury prevention, and so much more. Let's meet our panelists from Cedars-Sinai Guerin Children. First, we have Dr. Michelle Escovedo. She is an adolescent health specialist. She's here tonight to help parents of teens and tweens navigate their children's social and emotional challenges in the school year. Next, we have Dr. Shazia Lufiali. She is a pediatric allergist and immunologist. She's on our panel to answer your questions about allergies and asthma, including the latest treatments and medications. Next, we have Melissa Perales, a registered nurse from Cedars-Sinai Guerin Children Orthopedics and Spine Department, and she's here to discuss the importance of scoliosis screening. And finally, we have Dr. Priya Soni. She is a pediatric infectious disease specialist. She's here to talk about school vaccinations, what's on tap for cold, flu, and yes, even COVID this fall. We've got a lot to talk about today, so let's get started. Remember, if you have any questions for our esteemed panelists, please feel free to ask them in our Facebook comments. Our producers are monitoring, and we'll try to get to as many as possible. So I know you didn't come on to hear me talk, so let me get to our panelists. Good evening. How y'all doing?
Doing well, Ellis. Thank you.
Okay, we're going to breathe. We're going to get this thing going. We'll get this second. So, first question is for Dr. Soni. During the pandemic, regular doctor visits and vaccination schedules were disrupted for many families. Why is it important for children to stay up to date on vaccines, especially before the new school year?
Yeah, thank you so much for having us here. So really in COVID, we saw exactly what Ellis was saying. We saw a big drop off in declines in normal childhood immunizations. Everything was disrupted, and families weren't able to bring children in to get their routine immunizations. And this was a problem that we really saw worldwide. But now we've kind of understood how big of an impact that's made, with over 25 million vaccines missed worldwide. And so now we have to kind of do a better job of playing catch up and closing this gap for our children, especially as they head back into school, because these children remain at really high risk of dying and contracting diseases that we can prevent very easily with routine immunizations. So viruses like measles, they don't really recognize any borders, and we have pretty huge gaps in coverage in our kids. So now is the perfect opportunity to talk about, is my child caught up with all of his or her routine vaccines, and what do we need to do to get them caught up before the school year starts? Why is this such a big deal? We're already starting to see some of the impacts of the missed immunizations over the last few years, because we have seen outbreaks and pockets of measles popping up. There was a recent outbreak in Ohio earlier this year where 85 children were infected with this vaccine preventable illness. And measles is one of those viruses that the vaccine is very, very able to prevent infection. And most of these kids were unvaccinated, unfortunately, when they got sick. So it's a really good idea to have those conversations with your pediatrician and healthcare provider right now in order to fill those gaps for your kids.
That is a great answer. Does anybody else want to add to that? Because Dr. Tony just laid it out. So, folks, make sure your children are up on their vaccines. The other thing that we need to be talking about is physicals, right? So we know, and I think parents only think about physicals in terms of, if they're going to play sports, right? And say, oh, they're not going to play sports. Why should I be doing this? What's the whole point? So, Dr. Sony, Dr. Escobedo, Nurse Melissa, why should children and teens have a physical before the new school year? What is included in that exam? And what are doctors looking for? Finally, is there a point when teens or tweens have the opportunity to speak to their doctor in private? And I can tell you a personal story about that. But yeah, so why is it important for kids to have a physical before the school year, before each school year, and what's included in that exam?
I can start with this one. Yeah. So children and teens should generally have physicals done once a year, and at any point of the year, but it can be helpful to get a physical done right before school starts, just to make sure that things like your vaccines are up to date, that your hearing and vision are, that you're seeing, your hearing and vision are up to date as well, and you don't need a pair of glasses, right? And it's also great if you, for example, have a medication that you can take at school. That's a great opportunity to bring those forms to the doctor so they can fill them out so that you're ready for school to start as well, right? And then you can access your medications if you need them during school hours. And oftentimes as well, we can do the sports physicals with your annual physical. So really, like, this time of year is a great opportunity and time to get that annual physical done. Besides the general kind of screening exams, we do a head to toe type of physical, and extra maneuvers for the sports physical, if that's what, you want as well. And we really just want to make sure that your child and teen is growing and developing normally. That's really the main thing. In terms of teens during their physicals, there is generally opportunity to speak with the doctor in private, which is usually in the middle of the visit, after all their general medical history and their issues have been discussed. Psychosocial development is a really important part of adolescent development, who their friends are, how they're doing, mental health wise. And so that time alone gives the doctor a little bit more time to dive into that. And teens may also have some issues, as they get older, that they prefer to keep private from their parents, but still want a trusted adult that they can turn to for opinions and guidance, right? One of those kind of common issues may be like in relation to sex, right? But the reassurance I do like to give parents is that although most things do stay between the teen and the doctor during this conversation, if anything is ever unsafe or dangerous, that is a reason to break confidentiality. I don't know if anyone else wants to add anything else.
Sure. I just, you briefly mentioned that pre-participatory sports physical. So I know, many states are being represented here. And so there's many states where it's mandated, but then there's states where it isn't. And when we think of, okay, well, who's doing sports? It's not just about our traditional sports like our basketball or football, but if your child skateboards, if they're in the marching band, if they're in cheer, it's really important to get them screened. And it's the perfect time right now before back to school, especially if you're a mom that has lots of kids. It's kind of a good marker to remember, hey, this is when I do this every year, and screen your children so that we know that they're safe out there as they play. It's the time where they can see if there's any cardiac issues, pulmonary issues, and we want our kids safe when they're out there in the heat or when they're out there having fun. And so your physical is a great time to get that done. And so see your local pediatrician and get that done every year. It's really important.
And I will say it's a lot easier to get in over the summer, especially as we don't see as many sick kids with respiratory illnesses. And so it's a great time to do this. Totally agree with Dr. Escovedo and Melissa too.
You know, it's interesting. I remember I took my daughter when she was a teenager to her annual physical, and we went through everything. You did the questionnaire, doctor in the room, and then the doctor said, "All right, Dad." And I was like, I had that clutch my pearls moment. Like, really, what's going on? Like, you about to kick me out of the room? This is my child. But I recognize that there's some things that she might not feel comfortable talking about, up to and including if she was engaging in sexual activity and did not want me to know. And so for parents that might be concerned by that, I'm just going to say, yes, it was a moment for me. I had a moment, but I had to realize overall that her health and safety was more important than my knowing everything, right? And so she might feel more comfortable having a conversation with her pediatrician or with that specialist, and then they can work through her telling me versus me just forcing my way into that scenario. So parents, yes, it is disturbing because you think as a parent you're supposed to know everything that's going on with your child. However, let them tell you in their own time and in their own way, and maybe have somebody that they can bounce that off of that's kind of a neutral third party versus you that might, you know, lose control a little bit if they tell you something that you don't want to hear. So that's what's happening. We can have some conversations, and then, as they mentioned, if it's something that's serious enough, like they're harming themselves or thinking about harming somebody else, there's some provisions that are in place that they can break confidentiality and talk to a parent or somebody like that. So calm down, but they will ask you to leave the room at some point. Relax, it's going to be okay.
Absolutely. It's a totally routine part of the visit for all teenagers. Yeah.
Absolutely. So Melissa, Miss Melissa, scoliosis and its screening is often part of the school physical as well. In fact, some school districts now mandate them. What is scoliosis? That's first of all, because I know from a child from the 70s, I understand what it is, but what is scoliosis for our audience, and how does it present in children, and why is it important to do these screenings?
Of course. Well, scoliosis is an abnormal curvature of the spine. But the spine doesn't just curve, it also begins to twist and to rotate. It happens in about 3% of the population, boys and girls equally. However, girls can progress quicker than boys or have curves that progress even more so than boys. And it's a growth phenomenon. So it happens and can worsen during periods of rapid growth. A lot of you have teens and tweens. Why is that important? It's important because that is when they're growing the quickest. So in girls, usually right before their period starts, and the 2 years following that, that's when they're growing the fastest. In boys, it's usually around 13 to 14. And so that's when the curve can tend to progress, and why screening is super important during that time. Again, there are many states where it is mandated. California, where I'm from, it's mandated. And so girls in the 7th grade and boys in the 8th grade get screened by their local school nurse, a public health nurse that comes over to visit their school. But the issue with that, the downfall, is that that's just once a year. And sometimes we don't all follow the book, right? Maybe we don't grow just like the book tells us we're going to grow. And that's where your annual physical is really key and important. The Academy of Pediatrics, the American Academy of Pediatrics, refers to the pediatrician's office as the medical home. And home is the place that knows you best. So it's really encouraged that you take your child yearly, and that their pediatrician who knows them, who knows their health history, can monitor and assess and see any subtle changes. So when you think about scoliosis and the spine curving and twisting, with it comes the structures that accompany the spine. So the rib cage. So as a parent, you might ask, well, can I see it? Is there something that I can look for. And you can, in some children, you can tell that there's a little bit of asymmetry in their back. Maybe their shoulder blades are a little offset, or their shoulders are a little bit offset here. Sometimes their waist will have some asymmetry as well. And scoliosis isn't usually accompanied by pain. So a lot of times parents will say, well, how, I missed it. That's again why it's so important to go to your annual physical, and hopefully we're in states where it's mandated and we can screen our children so that we can refer them out, treat them, and hopefully prevent surgery.
Look, I just learned something. I just thought it was a curvature in the spine. So thank you for that thorough explanation and understanding the prevalence. So for parents, when the doctors or if your school is one that mandates it, please take it seriously and make sure that they're there that day of school as much as possible. Of course, if they're sick, please don't expose them to anybody else. But please, that is very important, particularly, as Nurse Melissa talked about, is that prepubescent entering puberty stage where the body is really going through that rapid growth, and we don't want that to be derailed at any point. So let's keep an eye on that. So staying with you, Nurse Melissa, if you don't mind, pediatric nurses, like I know sometimes like pediatricians they have a lot on their plate. So can parents rely, and how much can parents rely on pediatric nurses to kind of answer their questions and fill in the gap between their time that they have with the pediatrician for their children?
Of course. I think, the whole team is super important, and we all kind of function different, but our function at the end of the day is to really treat your child with the best care, right? And so one of the resources that you have is your nurse. And so as a parent, or maybe even as a young child, going to the doctor's office can be intimidating, and you might have a list of questions that you're nervous to ask them, and you don't know how much is too much, and you feel sometimes rushed, right? We've all been there. I've made notes before I go see the doctor. And so your nurse is a resource for you to kind of narrow down those questions before you go in and see your doctor, and maybe help to provide a more focused assessment. And when you're done talking to the doctor, if there's questions or you didn't really understand something, or you didn't catch something, you can always ask your nurse. Many times nurses triage, whether you are going to go to the pediatrician office or whether a visit to the emergency room is warranted too. So definitely a resource, and a resource for, Dr. Escovedo mentioned, there's stress that our children go through, especially in their teens. And so we can also provide resources for mental and emotional health as well.
Well, thank you for that, for helping us get those questions. I'm sure the pediatricians appreciate that, because they will get bombarded with questions from parents, and parents have a lot of questions, particularly parents of young children that are unsure. Parents can get a little nervous, right? And we want to get reassurance. And so thank you for being there to answer our questions and speak on behalf of parents. Dr. Lefiali, something that is very significant, particularly in children of color in urban areas, is asthma, right? And there's a lot of children that are dealing with it. So for parents and caregivers, what do they need to know to help children manage their symptoms and medications while at school? And what are some of the risks of untreated asthma? And how are the new and updated medications helping kids?
Yeah, thank you. That's a great question, and it's a really important topic. So I think the first thing here is really just to make sure that the parents and the kids both are able to recognize the symptoms of asthma. So the cardinal symptoms here are going to be coughing, wheezing, tightness in the chest, shortness of breath, and this can show up in a couple different ways. So for example, if your kid is coughing, usually an asthma cough is going to be more of a dry cough as opposed to like a wet, phlegmy cough. Kids can often cough at night, so they can have like a nighttime cough, which is kind of like a nagging cough in the middle of the night. And then also, they can have shortness of breath. So for example, if they're getting winded easily while they're playing sports, while they're running around, these can all be kind of, classic symptoms of asthma. We also want to make sure that we recognize not only the symptoms of asthma, but then also the triggers for asthma. So different kids are going to have, different triggers for asthma. In some cases, it's going to be like a viral illness. So every time your child gets sick, they could have like a prolonged cough, and that can be a sign of asthma. Other kids are triggered by exercise. So when they're doing PE or sports or something at school, cold weather can be a trigger. So for example, there are a lot of kids whose asthma tends to act up in the middle of the winter time. And then also seasonal allergies too, which is something that's very important to me, obviously, as an allergist. So kids who are triggered by, pollens and pets and dust mites and other types of things in the environment. So once we understand, kind of the symptoms of asthma and also the triggers for asthma, we then want to understand, how do we use asthma medications to make our kids' symptoms better? So classically, we've always used we've used inhalers to treat asthma. And here there are different types of inhalers. So for example, your kid might be given more than one inhaler. They might be given what we call a rescue inhaler, which is typically like an albuterol inhaler or something along those lines. And that's to help them kind of in the moment. So if they're having symptoms of asthma, you give them their albuterol inhaler, they start to feel better. The other type of inhaler, which we'll often prescribe, is something that we call a controller inhaler. So a controller inhaler won't necessarily make them feel better in the moment, but it's given to them on a daily basis, typically once or twice a day. And the goal here is actually to control their symptoms over the long term. So a lot of kids will actually have two different types of inhalers, and sometimes there's confusion, which inhaler should they be taking when. So that's something that's really important to discuss with your doctor, to make sure that you understand, to make sure that your child understands too, so that you're not getting those inhalers mixed up and you can use them kind of in the appropriate setting. We also want to make sure, I think somebody talked about this earlier, but if your kid needs to have their albuterol inhaler at school, let's say, you want to make sure all the necessary forms are filled out, the paperwork is filled out, so that they don't have any difficulty accessing their inhalers while they're at school. Similar with with allergy medications. So a lot of kids will be triggered by allergies. So in that case, they might also need to have allergy medications at school, whether that's antihistamines or nasal sprays. So those are all good things to make sure, we've kind of checked off the list before your kid is starting school. I think there was also a question about newer medications and newer treatments. So we do know that asthma management over the last couple of years has actually changed quite a bit. One example of that is something that we call smart therapy. So I know I mentioned that typically with asthma, we'll treat it with two different inhalers. There's actually another strategy which we can use now, which is called smart therapy, where your rescue inhaler and your controller inhaler are basically kind of put together in one. So here you really only need the one inhaler, and you can use this as kind of a rescue situation and a controller situation. So that's something, that your kid might be a good candidate for, and that's something that you can talk to your doctor about, or they might bring up to you. And then lastly, there's also, so there are some newer medications, which we call biologics. These are mostly for severe asthma, so kids who are kind of not adequately controlled with our traditional asthma medications, but these can really be a game changer too for asthma. So if your child has, very severe asthma, they might qualify for one of these biologics, which are typically injections that we'll give once every couple of weeks. And we really like these medications because they tend to work well, they tend to have minimal side effects. So that's really kind of what's new and what's been kind of really a game changer in the last couple of years for asthma.
I think what I want you to kind of reiterate for our audience, and we've had asthma discussions, especially with children before, is one, the rescue inhaler should not be your only form of asthma treatment. And number two, the emergency room should not be the only place where your child's asthma is being treated. You should be getting followed by even if it's just a pediatrician, you should have a regular doctor that you're seeing on a basis to where they're getting a full medicine treatment and not just a rescue inhaler in an emergency room if something gets serious, because over time that has proven it can be actually very deadly for children if that's the only methodology for your asthma treatment. So, yeah, I think I just said that. So, before we move to our next question, I just want to make sure that the audience knows that if you have any questions, please drop those in the comments. We want to get to your questions as well. We do have some questions for the wonderful doctors and specialists that are giving us their time. But if you have any questions specifically, please drop those in, and we'll get to those at the end of the broadcast. So, Dr. Lufiali, you brought up allergies, right? And I'm a person that suffers from allergies. I get those seasonal allergies, and I live in Georgia, so it's a lot of pollen, and I've got grass allergies, and I know when it's happening. I can feel it coming on. But how can parents know when to consider testing or treatment for allergies? And what are the differences in symptoms between a common cold or COVID and allergies?
Yeah, so that's a very good question. So in my opinion, I would say any child with asthma really should be tested for allergies at some point. And that's again because allergies are a very common trigger for asthma, especially in kids. So I think it's not a bad idea, whether you do this with skin testing, whether you do this with blood testing, they're both pretty comparable, but it is nice to kind of get those answers. What we typically test for are pretty much anything in the environment that can cause allergy symptoms. So like you mentioned, the pollens, these are grasses, trees, weeds. We test for pets, we test for cats and dogs, we test for molds, dust mites, cockroach, and all of these things really can trigger, allergy symptoms, which can in turn trigger asthma symptoms. So if we're able to kind of identify what it is that your kid is allergic to, if we're able to treat those allergies, then that can in turn, lead to much better control of their asthma. So like I said, I think any child with asthma should really be tested for allergies. If your allergy testing does come back positive, there are different ways we can treat this. So usually we'll start with over-the-counter medicines like antihistamines, Claritin, Allegra, Zyrtec are some examples. We'll also use nasal sprays. Flonase is a classic example here. And if these don't work, you can always talk to your doctor about other medications. We have other tablets, other nasal sprays, even allergy shots, for example, can be really useful. And then again, this ties into allergies, which then ties into asthma. So you're kind of, treating two birds with one stone, let's say there. And then your second question was about, how do we differentiate between allergies and, let's say, the common cold or some type of virus? So I would say it can be difficult, sometimes, especially when you're first starting to develop symptoms. Sometimes you don't know, is this allergies? Is it, some type of virus? So usually fever here can be a big clue. Allergies don't really tend to cause fever. So if you're, come down with a temperature, then that's probably going to be some type of a viral illness or a sinus infection, let's say. You can also look at, how long have your symptoms been going on for? If they've been going on for weeks and weeks, then chances are it's probably allergies and not so much, a little viral illness, which should have been out of your system at that point. If you notice a pattern, so let's say every springtime you tend to kind of get the same symptoms, you get itchy eyes, runny nose, sneezing, congestion, then that's again probably going to be allergies with like some sort of a seasonal pattern there. And itching too can also be associated with allergies. So for example, if you're somebody who has a lot of itchy eyes, a lot of itchy nose, itchy throat, that can also be a clue, that you're dealing with allergies as opposed to something like the common cold.
So, Dr. Escobedo, what do you talk to parents about if they come to you for allergies? How do you frame that conversation with parents to keep an eye out for allergies, particularly in their children? I think you're on mute. Let me see if I can unmute you.
Was that a question for me?
Yes.
Oh, sorry, I couldn't hear you.
Oh, wow. Can y'all hear me? I'm sorry.
Yeah, it was a little quiet when you were asking the question. Sorry.
No worries. I was just asking you, how do you frame that conversation with parents to give them cues of what to look for if you suspect your child might be experiencing some allergies?
I think going over all of the, signs and symptoms that Dr. Lupili was mentioning, the difference between fever versus, yeah, is it a cough? What kind of cough is it? I mean, it can be really hard to differentiate. And so I, I don't think the parent necessarily needs to be the doctor in this case. And, it's okay to, bring these concerns up to your doctor, your primary pediatrician, and have them, refer to, um, the specialist as needed, right? But I think most parents are, you know, want the answers, want why answers to sort of what's going on, right? And so,
Hmm.
yeah.
So, Dr. Lufiali, I'm just going to follow up on the allergy thing. Is that when does it get to a point? When does an allergy get to a point where you have to try to restrict some activities? I know it's easier to say like food allergies, particularly okay, can't eat nuts. I know that that's very very common. Eggs, shellfish, those are the kind of common things. Hey, but like for example, if a child is allergic to grass and they want to play sports, at what point, if the allergy too pronounced to where you say, hey, maybe you need to avoid sports that are played on grass?
Yeah, that's a great question. So I would say my goal as an allergist is always to get my patients to a point where they're able to do whatever it is that they want to do kind of in their daily life. So if you're somebody, who really wants to play soccer, then my goal is to get your allergies under control and your asthma under control to the point where you can, comfortably play soccer on a grassy field and not be bothered by either one of those symptoms. So I would say, if those things are bothering you, if they're causing you shortness of breath, if they're causing you coughing or wheezing or itchy eyes or runny nose or whatever the symptoms are, then that means, like you need to go talk to your doctor because chances are there's something we can do about it. Chances are there's another medication we can prescribe or, something that we can do in order to get you up to a point where you're able to comfortably do these things. So yeah, like I said, I think there are very few instances where we really, can't treat something appropriately and you have to say, you have to restrict whatever activities it is that you want to do. So I would say that all of those things are kind of a sign that, your asthma is not under good control or your allergies are not under good control. But that is usually something that's fixable. So definitely go to your doctor, go to your allergist and kind of talk about these things and relay that information so that we can do our job, and get you to a point where you're able to do what you want to do.
All right. Thank you for that. So Dr. Soni, I know it's August and right now it feels hot. But as time goes on, we're going to start moving into that cold and flu season, and it's coming up around the corner, so we have to kind of get ahead of that. Um, what should we expect this fall and winter in terms of RSV? And then we got to add that now to the list of things that we have to be concerned about: cold, flu, and yes, I'm gonna say a bad word now, COVID. Right? So, how can parents keep their kids healthy? And while kids are getting vaccinated, what about getting another three-letter vaccine, and that's the HPV vaccine?
Yeah, great question, Alice. Also, very loaded question for me because I could talk about this for the whole hour. But no, you're absolutely right. Now actually we are seeing an uptick in COVID cases overall, and it's the summer. It's August. So we are starting to see a slight uptick. It's not as bad as some of the previous variants that we've had in the past. However, we are going to see how it kind of plays out when we hit respiratory season and hit the winter. And typically, we have in the past, in the last few years, the COVID pandemic has changed the seasonality of some of our other common respiratory viruses, including respiratory syncytial virus, RSV, which you mentioned, as well as influenza. So actually zooming out a little bit and taking a look at where we were last year and the years before, we actually saw some RSV upticks that were happening in August and September. And so it's unclear about, is RSV and flu going to resume their normal seasonality and just be an issue more so for us in the winter months when we're inside more and crowded together a little bit more? Or are we going to see an uptick in these viruses as well? So right now, like I said, COVID is starting to see a little bit of that uptick, and we think that may be because it's just been such a hot summer and we're crowding indoors a little bit more. And for the first time in so many years, I think a lot of folks have resumed travel, whether it's in the country or internationally. So yeah, I think this is, again, a great time for us to take a step back and think about what's to come in regards to protecting our children properly as the season goes on and we head into the winter months where we will see most likely some surges in maybe all three coming up soon, but definitely I would assume that in the winter. So uh, for the first time, though, I have, great news, and it's very exciting because for the first time, I'm so thankful that we're able to protect our children against all three of these viruses for the first time. And so, obviously, getting our COVID vaccine and getting a booster for that for the newest sort of strains is very important. And the CDC, stay tuned because we're hoping to have a new updated version of our COVID booster coming up in the fall. And every year we update our flu vaccines. So scientists meet in February. We kind of see how the seasonal pattern of flu and what strains are circulating in the southern hemisphere when they have winter before us. And so they kind of match our flu vaccine to what they're seeing circulating in the southern hemisphere. And so we'll start to hear more about getting our flu vaccine starting in September. And for the flu vaccine, it's really important to remember you want to get vaccinated for this starting in September, but probably no later than October. And the reason for that is because when flu season kind of peaks in December, January for most of the country, you want to have the highest protection at that point. So it's important to get it in October and not wait until flu is sort of raging in December, January to then get the vaccine. So very important, especially as we're talking about children who have asthma and this kind of a thing. Please be sure they're up to date on some of these respiratory vaccines like flu and COVID. And then lastly, very excited to share with the group that we've had some recent updates with the RSV vaccine, that the monoclonal antibody actually that's available for babies from birth till about 8 months of life. And then they're headed into the respiratory season. It's their first season of the winter, and they're less than 8 months old. They will be eligible to get this one-time monoclonal vaccine that kind of protects them throughout the entire season against RSV. And I know, Ellis, you had mentioned that RSV, is something that we've been hearing more about, but I have to correct you because it has been around for so many years. And it has been the major cause of hospitalization for children less than 2 years old for decades. And for this winter to come and for us to be able to provide protection against all three of these viruses is very exciting to me and as well as many of us in the field. And we're hoping this means that we'll see maybe a less of a severe respiratory season in many ways, with less kids being hospitalized and getting super sick with these viruses. But yeah, the last thing you mentioned and asked me about was the HPV vaccine. So
Right.
yeah, HPV vaccine. So human papillomavirus, this is a very important vaccine because it's one of our only vaccines that can actually prevent your child from getting cancer. And so HPV virus is the cause of cervical cancer, but also important for the audience to understand that HPV can also be a cause for anal cancer, oropharyngeal cancer, penile cancer, and vaginal cancer. So there's many different types of cancers that could be caused and triggered by this virus. Um, and I know it's a touchy subject, and but it's now it's definitely all kids that are 11 to 12 should at least get 2 doses. We can even give it to children as young as 9 years old. And you may be thinking to yourself, oh my gosh, 9 years old, that is way too young. But you have to think of it like this, right? You want to give this protection to your child before they're at highest risk for, sexual activity and things like that. You want to put that seatbelt on your child before they head onto the highway, right? So it makes sense for us to want to protect our children kind of going into their teenage years. And the other thing that I wanted to say is that when you give the HPV vaccine, it's typically 2 doses, and as long as your child gets the first dose before they're 15 years old, it's going to be 2 doses. So after 15, their immune system requires us to give 3-dose series of HPV vaccine. So it's another reason for them to get it earlier, because we do see better immune response in kids that get it at that 11 to 12-year range. So very important, and not just important for girls, but also boys as well, for the prevention against oropharyngeal cancer and anal and penile cancer as well.
So, folks, it's a preventable cancer, right? It's a preventable. These types of cancers are preventable, but they've got to get this 2-shot regimen before, if they get the first shot before the age of 15. After 15, it's a 3-shot regimen. And I know we're talking about a lot of vaccinations, right? In addition to the 15 or 16 that they have to get on other things like MMR and all this other stuff. But I promise you, parents, the moment of discomfort is worth that peace of mind, right? And so, and I am shock avoidant. I'm the person that has to turn his head when I'm giving blood, because I can't even see it go in. It's, and I don't freak out or anything like that, but I just don't like it. But I tell you, I've gotten my flu vaccine the past couple years. I've kept up with my COVID, because it hasn't gone away. As much as we want to ignore it, people, it has not gone away. And that's why I was mentioning about RSV, because COVID dominated the headlines so much that when RSV started, entering the conversation, like, wait, and like, no, it's still here. So thank you for reminding us that it's still here, right? And it's not going anywhere. It's just COVID just got added to the list of things. The flu is still here, and it's still causing deaths every year. So please protect yourself. I love the imagery you said, Dr. Sony. Put the seatbelt on before you get on the highway, not while you're driving, because it could be problematic and it could be too late. So
And
go
I
ahead.
also wanted to just mention one last thing. As you're going to your pediatrician, checking up on your vaccines and making sure your child is up to date, if they happen to have gotten, one HPV vaccine and now it's been a few years or maybe a year since their first dose, they don't have to start the series over. You just pick up where you left off, like with all other missed vaccines. Thankfully, it doesn't put them, they don't have to get more shots just because they fell off track. So keep that in mind.
Don't have to hit the reset button, parents. All right,
Right.
let's keep it going. Get that second one. So, Dr. Escobedo, as an adolescent kind of specialist, we know that there has been kind of I won't even say recent, because it's been, 2008 is when social media really started taking off, right? And then it exploded, and now we've got a whole generation of children that are really connected, the social media generation, that are being raised in social media. Um, a new school year is a time of anxiety, right? Especially like if they're going from elementary to middle school, that's a whole different jump. Going from middle school to high school, that's a mental jump, right? And all of those changes that come through it for our tweens and our teens. And social media can compound that anxiety that they're just having by changing the schools. So how can parents check in with their kids about their emotions, like where they are, and what are the warning signs for parents that might indicate a deeper mental health concern in their children?
Yeah. My general advice is to try to keep an open mind and a non-judgmental perspective when talking to your child and especially your teen. First, you really want to get on their level, be interested in all aspects of their life instead of just checking in when you want to check in on the parts that you care about, right? Even if they seem trivial to you, and what's the latest TikTok dance? What kind of music do you like listening to now, right? And really, I wouldn't dismiss any of their issues or concerns. Again, even if they seem unimportant or trivial to you. We don't want to talk to children and teens who want to be independent adults from a place of distrust. And even if they don't give you much, when you're having these conversations, I always um, try to keep the perspective of just keeping the door open. I think that them knowing that you are a safe adult that they can trust and turn to when they do have a problem, that's really the biggest thing. And things that would worry me about a deeper mental health concern is if there's significant, like persistent changes to things like their grades, drop in their grades, right? If for weeks on end there's changes around their sleep, they're sleeping too much, they're sleeping too little, changes in appetite, they're not eating as much anymore, they're binge eating, they're eating, to soothe their emotions, right? Or if there's just a change in their motivation or interest, um, they used to be really into horseback riding and now they don't want to go anymore. What else is going on in their life, right? So that's kind of what would hone me into something of a deeper mental health concern.
So it sounds like you're saying parents, you need to monitor but don't meddle. Is that a kind of a fair way?
Yeah. Yeah. Good to check in. Good to be an involved parent. But give them their space too, and they'll come to you when they're ready. Yeah.
Absolutely. And the other thing I think I heard one time, they said an atypical mood swing, right? Because they're teenagers and they're going through puberty, so there's going to be some mood swings that happen. But something that is atypical is something. And how do you say what's typical and not typical for you? But you know your child, right? You've seen them. You should know and recognize what is a typical mood swing for them and what is something that is beyond the pale a little bit, and then you say, okay, what's causing that? What's really behind that? Avoiding behaviors is also something to kind of keep uh, mindful of. If they used to go to certain activities and often they don't want to do that anymore, they start avoiding things. You start seeing that there might be something that's underlying that's promoting, prompting that avoidance behavior, and that's something you kind of keep an eye on when it comes to your children. But social media again, what's some guidelines that parents can use to help their kids kind of manage social media and that screen time that they love but we typically don't like so much?
Yeah, so it's all over the news, right? Social media this, social media concerns, what's it doing to teen girls? And the Surgeon General came out with new guidelines as recent as May, just a few months ago. And generally a summary of these talking point, summary of these guidelines are: one, have open communication about the risks and benefits of social media with your child or teenager. Two, come up with boundaries and rules surrounding social media use, right? They're not going to not ever use it. So if they are going to use it, what are the rules around that? For example, no phones during dinner time, or no phones in the bedroom, things like that, right? And how much time they're allowed to be on it. You also then want to monitor other aspects of health, including their sleep, physical activity, and their mental health, because these are aspects of health that can be affected by social media, right? And really making sure that you're balancing your online life with your real life. And we all kind of struggle with that and deal with that, right? But checking in on that and making sure that your child, has that balance. The other thing is teaching social media and internet safety. So don't ever give out personal information, right? Things that sound obvious to us. Don't ever send a compromising photo of yourself. Don't talk to anonymous random users. What may look like a scam or fake or misinformation. These are things to, start educating your child about early. Um, and, in terms of using social media and screen time, generally the consensus is to delay as long as possible in terms of giving a phone to your child. And, children really shouldn't be using social media, but that is something that, you will eventually have to deal with in your teenagers. Yeah.
So, and this is kind of the hard question, but we need to ask it because this is where people can get some great information. So, if parents expect that their child may be depressed, right? They're having those signs and some things that you talked about, and potentially could be harming themselves or wanting to harm themselves. Who should they contact?
Yeah. So, your primary pediatrician is a fantastic first person to call upon. They can connect you with the correct resources, such as a therapist, a counselor, and depending on the pediatrician, they may be comfortable managing the depression and issue with medications as well, if that's what the family agrees to, right? They can also help you come up with a safety plan. So, if someone is actively suicidal, what are the steps to take to make sure that your child is safe? You can come up with that plan together during your doctor's visit. Schools also have counselors as well. So, I usually direct families to, both of these resources. And then the last thing is the 988 hotline. It's relatively new. But it's supposed to be an alternative to 911. So if it's a Saturday night and the doctor is not in and schools are closed and your child is having a mental health crisis, you want to call 988 so that they don't send police to your house. They send a mental health team, right? And this is a 24/7 nationwide line that you can call that where you get connected to trained counselors and are given support and services.
So parents remember that it's not 911, it is 988 if your child is having experiencing a mental health crisis because you have professionals there that are trained to be able to help you get through that issue. All right. So, Miss Melissa, for parents of student athletes, and you're speaking to me now because my son is an athlete, what are some ways we can help keep our kids safe from injury during the school year? Um, and what is that point where kids can just, shake it off, like we say, rub some dirt on it and return to practice or games? And when should parents insist on rest or medical evaluation or intervention? So what is that line between rub dirt on it, walk it off, and you might need to have a doctor or a specialist take a look at
Of course. I'll start there first, actually. I think kids are super smart, a lot smarter than we sometimes give them credit. And so, a kid will modify their sport or level of activity if they don't feel well. And if they're modifying and it's difficult to get back to their sport, or if they're saying, I want to sit out, I don't want to participate right now, I don't feel good, that's usually a red flag. Kids self-regulate. And so if they can't participate or if they're constantly modifying their sport, they should see their pediatrician. And, if there's any further red flags, they can then refer them out. Any pain, kids, if they're having pain that's waking up in their sleep, that's a red flag. Definitely bring them to their pediatrician. And then any nerve change. So if they have numbness and tingling, if they have accidents with bowel and bladder, definitely don't just shake that off, have them checked. That's really important. And one way of keeping our kids, ready to play sports and also safe when they're out playing sports is good nutrition. So good carbohydrates, good protein, healthy fats, but really most importantly, hydration. So it's really important for them to be well hydrated, well hydrated prior to playing, and also hydrating, readily accessible to, be able to hydrate as well. And, again, we represent many states where there is a lot of heat. It is hot out there. And so when they play, it's really important that, especially those states, that they have ice buckets ready with towels so that they can cool themselves down in times of, extreme heat or heat exhaustion. We even encourage for athletes to have readily available a tub of ice water where they can first cool down before they transfer out to safety. Having a medical team readily accessible for those athletes too, and an AED is really essential to prevent sport injury and prevent, heat stroke even. So those are important things that your students and kids that are athletes should have readily accessible and available to them.
Absolutely, and I think even though it was a tragedy, it was two tragedies. We had Bonnie James there at USC, and then we had Damar Hamlin. Those tragedies really heightened the awareness about the need for having an AED, particularly to resuscitate for cardiac arrest.
Yeah.
And I would say something that parents can do is go get CPR certified, but go get CPR trained, because you don't know how it can save a life, particularly on those chest compressions, because not everybody is as lucky as Bronny James and Damar Hamlin, where they have a fully trained team there, readily available to kick into play. Sometimes it's not that simple, and so having a parent or somebody on the staff that knows how to do at least just CPR while they're calling 911 can be the difference in saving and losing life. So parents, please be hyper vigilant about that. That bucket of ice water is really, really cool. If somebody starts to overheat, they can get down in there. That they really need a tub with ice water, but schools have budgets, and so we have to work around that. Parents pull that together and figure out how to keep our kids safe from those injuries. But yeah, you're absolutely right. That avoidance, that pulling back, all of those things, we have to notice it, right? We have to be hyper vigilant as parents. So, wow, that was, y'all are fantastic. I'm sorry, that was spontaneous. Yeah, that was just great. Just wonderful information as we're getting our kids back to school. Just really want to thank you all for being here with us tonight. Thank you to the audience for watching. Thank you so much to our viewers. Uh, the questions were so great, and our expert panelists from Cedars-Sinai Guerin Children for this informative discussion. I want to thank you, Dr. Soni, Dr. Escobedo, Dr. Luciali, and of course, Dr. Melissa, you're fantastic, just for joining us today for this community conversation. I thank all of our parents, grandparents, and caregivers are well prepared for making sure the children in their lives have a healthy school year, thanks to all the information that you've shared with us. So there's a lot of things that we talked about. We talked about getting those vaccines up to date. We talked about monitoring their asthma and allergies. We talked about preventing injuries. We talked about social media and screen time and really kind of watching their moods and things like that. So all of those things are really that go into helping a healthy child develop. Keep monitoring on all of that. Parents and caregivers, if you need more information about school physicals and school vaccines, contact your local school district for their requirements. Remember, your pediatrician should be your first stop on your health journey, and keep those lines of communications open. If you'd like more information about Cedars-Sinai Guerin Children in Los Angeles, we're sharing a link for you to visit. Thanks so much to Cedars-Sinai and for all of us here at blackdoctor.org and Daily Vitamina. Thank you for joining us, and we just really appreciate you being part of this broadcast. That's it. Let's have a good night, and we'll see y'all next time.
Thank you so much.
Thank you, everyone.